Have you heard of an endodontist? Well, it's someone who specializes on root canal treatments and saving teeth. More than 80% of those practices are fully reopened now, and most of the specialists were open even for emergencies during the height of COVID-19.
And so Sarah spoke with the president of the American Association of Endodontists this morning on new safety protocols for those in-person dentist visits.
Severe tooth pain and dental emergencies don't stop happening even during a global pandemic. And even though people may still be very weary of visiting a dentist, ignoring tooth pain will only make your dental issues worse and could potentially lead to long-term issues with your teeth and gums. Joining us today on Studio 3 is Dr. Alan Gluskin. Good morning. How are you?
I'm fine, Sarah. Thank you. Nice to be here.
Oh, we appreciate you being here. So tell me, doctor, what constitutes a dental emergency?
Well, most people know something's wrong when they're woken up out of a sound sleep at night with an unremitting throbbing in their jaw that they know is coming from one of their teeth, or a tooth that's been bothering them, and now the time has come. Often, most people know when they're having an ice cream cone or something hot or cold, and it makes a tooth hurt for minutes or more, that may not go away. Sometimes we can be watching television after dinner, sitting in a chair, and we get a light ache of the body bringing extra blood to a tooth that is degenerating or injured or decayed, and the patient hasn't taken care of it, knowing that the tooth had a hole in it. So we know that these kinds of emergencies can turn into some very serious swellings and pain. And we don't want patients to have to go to a hospital during this COVID time and have the hospital have to deal with their pain. And there are a group of specialists who are specialist dentists who go to school for 2 or 3 years. They're called endodontists, and endodontists are used to handling this kind of pain, saving the tooth by doing root canal therapy. And everybody knows what root canal therapy is, where they take a tooth that's sick, they remove the internal structures that form the tooth when you're a child, and they stop your pain, they save your tooth, hopefully for a lifetime, because they're skilled professionals at saving teeth.
Wonderful. Well, along with some safety standards and sterilization precautions regularly implemented, what additional prevention steps are endodontist offices taking?
Well, 100% of endodontists use a rubber dam. A rubber dam is a very thin piece of rubber sheeting that goes over the tooth that they're working on. It protects you from their, and they should be masked and protected from their breath and the aerosols that come from their breath on you, and from your aerosols that might go to them. The rubber dam is absolutely one of the best ways to protect that interaction between the doctor, the staff, and the patient. We use microscopes to look down inside teeth. We don't have to put our heads halfway into your mouth. We use a microscope that magnifies the inside of the tooth 10 to 20 times, and we use three-dimensional x-rays that go around your head, so we don't have to put so many films inside your mouth. We are constantly using sterilized single-use instruments so that we throw our instruments away after we've used them on you, and all these things manage to protect you in a very insular way. When you have a toothache, you should not avoid one. You need a specialist, and if you need good care and you want to save your tooth for a lifetime, seeing an endodontist for that care is a smart thing to do.
Doctor, talk to me about what patients should expect when visiting a dentist office, and not only from the dentist office and the staff, but also what they should do to prepare to go in.
Well, most patients should understand that the dental office is very concerned about socially distancing. So if you go to a dentist or a specialist endodontist, they will have you, many offices will have you wait in your car and call you on your cell phone, so you can be socially distanced from possibly other patients that are having treatment in that office at that same time or just before or after you. You should see the staff wearing masks. You should see the staff washing their their hands during times when they're touching multiple things. You should see the staff working to wipe down the office, the waiting room, and the operatories where you are being worked. You should see that that office cares that you are in a safe environment.
My children went to the dentist yesterday, and I saw all of those things. So thank you, Dr. Gluskin, for being here. We appreciate your expertise at this time.
Thank you, Sarah.